Hi, everybody. I'm Gina Wertenberg, and I want to welcome you to the executive panel on leading social innovation, insights from executives across sectors. We're delighted to have with us today Noah Gafni, the executive director of the Rutgers Institute for Corporate Social Innovation, affectionately called RICSI, which is one of the key sponsors for this entire conference, as well as where I participate as the Associate Director for Education. We have three wonderful panelists. First, we have Terence Blackwell, who is the President and Chief Executive Officer of Chimes Family of Services. We also have Kate Lawrence, who is the Director of Jersey City's Office of Sustainability. And we have Renuka Gadde, who until a few days ago, it was the Vice President of Global Health at BD and has just transitioned into an exciting new position. I just want to mention one logistic, which is that this is a webinar, and we would really appreciate it if you would put your questions in the Q&A when you have an actual question. You're welcome to chat away, but when you do have a question, put it in the Q&A so we can find it. Okay, well, thank you very much, and I'm going to turn it over to Noah Gafni. Take care.
Thank you, Gina, and thank you for organizing this incredible event. I know so much work has gone into this conference, and what a great success to be speaking with people from all around the world and really connecting around the Sustainable Development Goals. So I'm really delighted that we have this esteemed group of panelists who represent a number of sectors. We really wanted, the whole public-private partnership realm to be explored here, and so to that end, we do have participants from government, nonprofit, and the private sectors. So really grateful to have you all here today. And why don't we kick off with a round of introductions? So why don't you tell us a bit about yourself and your background? Let's kick off with Kate.
Hi, everyone. So my name is Kate Lawrence, and I actually, after I finished and graduated from undergraduate school at Bard College with a history major, I wasn't sure what I wanted to do. I knew that I wanted to go into the public sector at some point, but I wasn't sure. So I ended up doing 2 years of AmeriCorps, one through the NCCC program based out of Charleston, South Carolina, working with a team of individuals on projects like trail building and building houses through Habitat for Humanity. And then I moved to Boston and worked with a nonprofit there also through AmeriCorps. By that point, I realized that I wanted to go into urban planning. I had realized that when I was in the South and just sort of thinking about why certain parts of the states are developed in different ways. And so I got some experience working for a planning firm as their administrative assistant within Boston. I got a year's worth of experience while I applied to planning schools. I went to Rutgers, the Blaustein School of Planning in New Brunswick. And then when I graduated, I moved to Boston, work for a nonprofit and a regional organization, planning organization, and then got my first big planning position working with the city of Albany, New York as their sustainability planner, and then Jersey City as their environmental planner, and then founded the Office of Sustainability within Jersey City about 3 years ago. So I've been in Jersey City almost 5 years now.
Wonderful. Renuka?
Hi, Noah. Thank you for this excellent opportunity to participate. And it seems like it's a wonderful session already with global participants. The feedback that I just heard about your morning session was also very encouraging. So a bit about myself. I come from India, and I joke, as you can see in my blue eyes and blonde hair. Well, it's a giveaway that I'm from India, of course. And I actually have a master's in business administration as my educational background. And I've spent 23 years in one company, which is probably a bit unusual in this day and age, but I worked with Becton Dickinson. I joined them in Singapore, running their regional immunization program for Asia Pacific. And I'd say that, like Kate was talking about public-private, and you were mentioning the partnerships, that role very young in my career laid the foundation for public-private collaboration, because immunization is such a public health issue. And here I was in a for-profit private sector trying to solve the same problems that our public sector colleagues were solving. So that became my basis and of foundational interest in the space of global health. I moved to the United States in 2002, worked with several roles in different positions in BD with Gary Cohen, who is one of the founders or the founder of the Shared Value Institute at Rutgers. But I worked with him in strategic planning, running the injections platform. Then I moved into a different part of BD, and finally global health, bringing together the private sector competencies to solve global problems. And I just transitioned into a new role as a senior advisor with the Clinton Health Access Initiative, or CHI, which does exactly the same thing, working with private sector to create health access, focusing on the low middle income countries where there is a high burden of course. So that's my story and background of how you can harness private sector skills to solve very complex public health backgrounds through business models. And that's my basic training in the space of business, so to say.
Wonderful, thank you. And Terence.
Hello, I'm Terry Blackwell. I'm the CEO of Chimes International, which is a human service agency with a nonprofit status in the US. We're a fairly large human service organization. We serve 7 states in the Mid-Atlantic and the Tel Aviv region of Israel for persons who have intellectual disabilities and autism. We provide an array of residential opportunities or services that go from group homes to private residences to apartments. Currently about 1,000 people in residence. We also, excuse me, have 25 different federal and state contracts where persons who are, quote, disabled for the work provide services in places like Fort Bragg, the Pentagon, Dover Air Force Base, BWI Airport. And these are jobs where people require special considerations and supports, otherwise they would not be employable. It's a program called the Ability One program. I ended up graduating undergrad in Jersey City at St. Peter's and made it into University of Pennsylvania, which at the time I thought was Penn State. My mentor corrected me aggressively. And as part of my electives, I did my electives over at the Wharton School of Business Entrepreneurial Study. And that really changed the way that I thought about how business could be used to kind of design a life mission. So today I am a licensed school principal in the state of New York. I am a licensed behavior analyst, which I've done clinical work directly for children with autism for probably 20 years. Chimes has about 4,600 employees across the 7-state footprint, an annual operating budget of $220 million. I've taught at Seton Hall's graduate school, and I figured out that when you're an old guy, you get to do a lot of things, and I'll have a long resume, so I'll just stop talking.
No, not at all, not at all. I think it's great to hear your impressive background, and just wonderful to see the wealth of perspectives that we have on this panel. Before we jump into the questions, I just want to let our audience know that this should be an interactive session, and so please feel free to share your thoughts in the chat and then formal questions in the Q&A section. So just a reminder that we really want to hear from you as well. In terms of just jumping in, so how would you each describe the biggest challenge facing your sector today, and how have you adapted and addressed it accordingly? So why don't we start with Terry this time around?
Great question. For us, I mentioned the residential programs. Perhaps our biggest challenge right now is the uncertainty of the environment that we're living in. During COVID, back in April and May, we had 4 deaths. 3 of the individuals that we served, one lady who was as young as 32 who had Down syndrome, became infected and passed away in a week. And then we had a gentleman who was actually with us for a very long time, 84, got the COVID virus in the morning and had passed away by the end of the afternoon. The uncertainty that I mentioned is very difficult. In the nonprofit sector, it's been my experience that government rarely overlooks a crisis as an opportunity to claw back funding. So I think that although the tax status of a nonprofit is just a tax status, we have a unique business dilemma that we're not price makers, we're price takers. And so serving these 1,000 people, as government begins to look around and say, well, how can we do it more efficiently, which is an acronym for cheaper, we're actually getting to the point where government has destabilized a lot of the services that took 50 years to build up for people with intellectual disabilities and autism. And so we continue to be creative, but we find that most agencies who are human service providers below a budget of $50 million, there's simply nothing left to cut. And so services and quality of services is beginning to be impacted.
That's a huge challenge, and certainly something I'm sure you're seeing from a different perspective as part of the government, Kate.
Yes, absolutely. I think that one of the biggest challenges that someone within sustainability or, similar fields within government and planning is the fact that people have lost sometimes faith in the government to work well, or they try to reduce the cost of programs that aren't deemed essential. And a lot of the programs, a lot of the sustainability offices within the country first started under the Obama administration with funding that created them and sort of allowed them to exist. And then they've had to sort of make the case for themselves ever since. And so I think that people within the industry have reacted by just trying to be nimble, trying to make the case for the worth of sustainability and thinking long term and thinking holistically, and then also working collaboratively with others and trying to adapting to the times as much as possible, just because you can still do the work even if it's if the office changes names or the administration changes priorities, you can still find ways to move these initiatives along.
That's very true. It really does go beyond the title, and something I know, Renuka, you know very well, just given your background in the private sector and how the nomenclature has changed over time, whether it was shared value or its predecessor. So really curious to hear your thoughts as well.
Thank you, Noah. And so, like everyone else, these are such crazy, unprecedented times, right? So for a private sector, I still remember it was March 12th, I think. We were driving up to work when we got this message saying, we kind of working from home from today to till we know how this COVID situation is going to play out. And fast track that to today, everyone's working from home. Mostly, the essential functions are being reporting back to the office, R&D or engineers who need lab instruments. But the biggest change for us is we BD, and I'm putting on my BD hat here, a healthcare company who has to solve a problem during a very crazy crisis that no one knows enough about. So how do you even get a diagnostic test to understand and detect whether this is COVID or not? How do you make this test available in large volumes and high scale when people are actually constrained to even go to work? So you can imagine the agile nature of how we had to adapt to change was never greater than the current situation. So the company had to come together to figure out and continue creating robust product, collapsing timeframes in what would take several years into weeks and months, and yet be responsible to bring out a test and scale that. So that's kind of the BD hat. Now putting on the CHI hat, the Clinton Health Access Initiative Act, how do you then take these technologies that are coming together and really reach the low middle income countries where the affordability is a challenge, having good health systems is a challenge, you don't have the same sophisticated labs, reaching people can be a challenge. And how do you do that in a manner that companies are not being penalized because they need to make their money on their investments, and yet you're kind of creating that access and affordability. So kind of pulling together and creating that enabling environment such that it truly becomes a shared value where you're doing well, but also doing good, kind of working across that spectrum. And it's so interesting because the skill set that you need to do both the upfront product development and the downscale deployment are all very much business skills or business models, if you want to put them into a model of some nature. But they need the collaborative nature of both the private sector as well as the public sector, because you can't do it alone. You need the intermediary world of the NGOs to bring and coordinate and collaborate. So it's been a really interesting challenge. And we're just talking about diagnostics here. Then there's the challenge as the vaccine becomes available. How do you immunize people around the world? So health is core and central in this particular pandemic period. And what's interesting is no matter where you are, whether you're in New York, Nigeria, it doesn't matter, the same virus that's kind of going around. And if you solve it in one place, it is insufficient, because a virus, as they say, a virus anywhere could become a virus everywhere. So it really brings in a whole new capability here to say, how do you respond to a global crisis globally, even if you are a local player, but how do you bring together through creative collaborative models to solve the challenge? This is unusual. No one's prepared for this, and every single day there's a new learning or a new way of looking at things. So I would say this has really been one of those most dynamic, fast-paced. It's what's happening to the world is kind of sad, but I think how companies are coming together, how governments are responding, how donors are coming together, how the NGOs are coming together has been really incredible to get to this point where we are. Even simple things like doing a Zoom panel is unique and different. And that's nice because the world doesn't stop. You have to change your ways of working together to address. So the health sector, I think, has been really looking at how can you collapse and make things available faster, quicker, cheaper, right place, right time. How do you look at logistics, supply? How do you look at affordability for both the developed and the developing? So it's been a really incredible number of things that are being managed by companies, both in the health sector and the governments, I would say.
Wonderful. And we do have a couple of questions in the chat about levels of government. And so just want to reframe those slightly and ask, Kate, you worked in different contexts at a kind of local and state level. Terence, obviously you work with governments internationally as you situate your nonprofit in many different locations. And Renuka, obviously your expertise is really around public-private partnerships. So what challenges and opportunities and differences do you see between different levels of government, both here in the US and abroad?
I can jump in a little bit because we work predominantly with Medicaid funding for the intellectually disabled and persons with autism. That may shift when you have people who are under 21, because we also have a school. But the federal funding, and this is just, I think, generic for the United States, federal funding flows through state funding, which then has a match of some level. So for example, this morning I was speaking to Dr. Ted Kastner, who's the commissioner in New York State for their developmental disability service. He has a $6.8 billion budget, which is just crazy to me. I mean, the size of that. But again, that same comment about uncertainty, he was essentially saying something that I think Renuka kind of hooked at or hinted at. The uncertainty of what's taking place both at the city in terms of structural deficits and at the state level has created, I guess, a tension that wasn't there. There's always been a tension that there's just not enough money to go around for everybody to get everything they want. This is a new type of tension. There's an uncertainty as to what actually is available. So I know that we deal with Congressman Patrick Murphy helps us to work with some of our congressional delegates. We work certainly in the city of Baltimore and Fairfax County with the local politicians. But I think more so now than ever, there's a need for continuity and communication. What is it that you're asking us for, to be precise? And how will we know if we've provided that to you? That's been helpful for us.
I can add some comments from an international perspective as well. So clearly here in the US, the federal government took a proactive position, reaching out to companies, looking at where can they support companies to get their products out, earmarking some of the product to reach different states. So that's kind of a well-oiled machine here. Internationally, what's happening is people may be familiar with the Global Fund, which is, again, I'd say a public-private partnership. It's the largest financial instrument established by governments from across the world, whether that's Europe, US, Asia, name it, all of the Africa. The governments around the world come together and have established this so-called funding mechanism, primarily to focus on HIV, TB, and malaria. And this happened in the early 2000s, and the Global Fund pulls in billions of dollars to address these 3 disease states. But what really happened with the COVID pandemic is clearly the onset of COVID not only impacted the HIV, TB, malaria services, but obviously COVID per se was impacting individuals. And so the Global Fund quickly morphed its agenda to also add on COVID into the mix so that you could piggyback on existing mechanisms, mobilize activity immediately, and use the same models that you have for access to HIV, TB, and malaria, but use the same models for reaching out for COVID. And so governments came quickly around the table. Agencies such as FIND, such as CHI, came together, negotiating and brokering between the companies and the governments to create a global access program. And I'd say that if we didn't have that mechanism of working with the governments, working with them on their country plan, no single player would be able to reach that scale and drive that volume so significantly. So there's a really interesting role, and governments in this context and international tend to be the central government, and then they plan for their own countries and their own states and their own populations, depending on where the burden is. But it's maybe the equivalent to the federal government. That, I think, was your question, Noah. So, but this model kind of tells you how you have to kind of engage and work across governments with their national plans as you're kind of driving something top down, but building plans bottom up, so to say.
I don't work very much with the federal government, though sometimes they do provide funding through, for example, the DOT or the EPA, for projects that have overlap with what I do. However, I'd work with the state government a lot, and I work with New Jersey state government. And when I was in Albany, I worked with the New York state government. And I'll say that it's very helpful, or it has been very helpful working in these 2 states. When I talk to colleagues that work in sustainability fields in some states that don't have robust state programs around environmental issues, they have a bigger uphill climb. So one thing that both New Jersey and New York State have done, if they do initiatives and they do projects that help the local governments or that provide sort of a foundation, a baseline for research and just, standards for going forward. For example, right now, New Jersey just recently issued a report on climate change in the state, and the governor has been doing a lot of work around trying to get climate change as a factor that's considered as part of all state plans and planning going forward. So that's really important for me because, let's say I work with colleagues in transportation. They get a lot of their transportation funding from the state. And so it's wonderful when the state is considering climate change and other environmental issues as part of all of its programming and projects, because it makes it that much more coordinated and less difficult for me to try to also deal with those issues across the board within the city.
So maybe I just add more point here, Noah, to the well-oiled machine comment that I made, and I just see some reaction on the chat group there. But I think my comments there were, when FDA came up with an emergency approval system, and I'm limiting this to just the governmental actions, and we can debate on whether the US is handling the issue correct or not. That's not where I'm going, but I'm just talking about the framework that they allowed, because typically getting your product past an FDA approval would have taken many months, sometimes years, right? And this emergency system that was developed with quick review, quick processes, BARDA that supported the funding to say, urging companies to invest and come up with technologies. So to that extent, there's a process and a mechanism that was taken advantage of, or that responded well to enable companies to come up with solutions. So maybe to that extent, that comment of mine would be limited to that part, let's say. And internationally, similarly, leveraging Global Fund or leveraging the World Health Organization that came up with the emergency use authorization for tests. Even the debate internationally to say, how should you allocate diagnostics and vaccines when they're available, such that there is equal distribution and no one country is ring fencing usage of technologies just for themselves. So those kinds of debates are really happening, which they ought to be, but thank goodness they are, because otherwise you wouldn't be able to solve something at this global scale. So I just wanted to clarify the context in which I made that comment. Back to you, Noah.
Great, thank you. Just switching gears a little bit, I'm conscious that we're happy to talk about government responses here without getting too political. And so just want to talk a little bit about skills. And obviously this whole conference is really focused on business education and practice. And so as we think about ways that we can link the two more effectively, what would you say are the skills that are really needed in your sector and the skills that have helped you succeed and help others as well?
So I'm happy to go with it. I think, so first I want to say, when I look at schools today and the focus, we just talked about my health sector, the interest of the youth in global health is just overwhelming. I think we have very smart student pool who want to be very conscious of where they want to work, how they want to work. They want to really do very well and do good at the same time. So that's kind of really nice observation, at least that I've seen over the last few years, with such deep interest to solve problems that are complex and wanting to be engaged in that space. So the skill sets I would say is, apart from what the institutions organize, whether you're getting your degree in MBA or MPH, these are all great programs in whatever space you are in. But I think the fact that today schools, including the session that we're just having right now, and with the corporate social innovation establishment of this wonderful unit within Rutgers, these kind of skills raise awareness, give students the opportunity to explore, to kind of come up with out of the box thinking, to solve problems that are global in nature. So I'd say that these opportunities didn't exist in this significant systematic manner as they do today. So I think students today have this wonderful opportunity to take advantage of this and go as far and deep as they want to. I'm also on the Rice University 360 Advisory Committee, and I see students there, reveling with innovation ideas, where they take their school classroom projects to the field to test them in real life situations. And the schools are providing that kind of enabling environment to learn, to understand what it would be to take something from the school into the real world. So I think those opportunities are excellent. So the skill set I'd say is simply wanting to learn and expand your horizon, to think global while you're acting local, to really have the qualities of perseverance, because some of these challenges in my sector, at least, are not easy to solve. And they're not always, profitable either. So how do you kind of be creative to meet your goal of making a return, because that's what a company does, and yet also solve some of these problems in a meaningful manner, right? So you're really looking at learning to be a global citizen, learning to solve problems here in the place that you're living, and at the same time have that vision to say, how would you take this to a whole part of a new world? So I would say creativity, looking at how do you make your technologies scalable and suitable for not just very sophisticated environments, but also for environments where you may not have that infrastructure, but you have the need. So I think that curiosity, the ability to learn, really taking advantage of the programs that are around here. Never before, I think, you've had such access to understand and move and take your classroom ideas globally. And I tell you, when I say taking classrooms ideas globally, it's not just a statement for the sake of saying it. I've actually seen and witnessed how these can become big. Case in point, a company called Sanergy, which was an MIT classroom solution that then the students took out to Kenya, making this into a big business. The MIT Solve problem is similar in nature, where they invite folks to come in and solve a complex innovation. And I think the fact that you have a corporate social innovation program here that people can leverage, learn from university, from industry, and take it out is something that's unique. And so that kind of intellectual curiosity is something that I'd say people should kind of learn, because it is a global world. What's happening in one part can easily impact the other.
Absolutely. Would anybody else like to jump in?
Sure. When I got to Chimes, I came out of an organization that was in Manhattan as their chief operating officer. It was roughly the same size, but I had never encountered the wonderful world of litigation against the federal government. And when I took the position at Chimes, I knew that there was a long-standing argument with the Federal Department of Labor. What I became educated upon was that when you decide that you really want to throw down and prove the facts, the government has more money than you have, and more endurance. And I think what that lesson taught me, and by the way, it was, I think it's available, I know it's available, the Department of Labor versus Chimes, we were successful on 5 out of 5 points. That rarely happens, but the government required the production of almost 4 million documents. And so the amount of energy and time and drain, it was learning curve to realize that the phrase "this too shall pass" becomes a very, very important management skill. As bad as it is, tomorrow will come and it will be better than it was today, or it will be worse, but it will still come to pass. And I think one of the greatest learning opportunities for me was to figure out, look, stay in the current moment, be very, very focused. And by that, I mean, I found that very often when we were hiring attorneys, the skill that we were paying them for was to read precisely the documents that were put in front of them, and that many people who had gone before them had kind of scanned over or skimmed through the documents. If you're in an MBA program at Rutgers and you read that document that's put in front of you entirely, I'm not saying you are a lawyer, but you'll find out that your conversations are much more productive. And last but not least, I think on skills that are important, having an IT background. If you're a finance guy who knows Python or knows some good IT background, it will help you to extend beyond a limited range and develop a thicker skin. Somebody saying to you no doesn't necessarily mean no unless you shut down, right? Take the no, learn from it, adjust, and move forward. And in today's market, I see this a lot with younger individuals who are submitting for jobs online. I hate that system. Because why? Because you're sending out 100 resumes and it's so easy to just click the delete key that you never even get past the front door. There was a really good book, which I think is still out there, called What Color is Your Parachute? about career balancing and career development. And his suggestion was basically find out what is your dream job, do the research, find those companies and approach them, as opposed to just being one person out of a million who's uploading a resume and waiting for the Hail Mary pass that maybe tomorrow you'll get picked. That's it.
Thanks. And we do have a question in the chat around COVID and how that's impacting the future of work. I just want to broaden it a little bit and say, the converging factors around the social justice conversation that's happening now around the US, the impacts of COVID, obviously, and just this overall trend around the future of work. Do you see these skills as being dramatically different than when you came into the workforce?
We've had conversations about the importance of staying focused on the people that we serve. And it's tricky, right? The social justice issues are real. At the same time, a petite behavior analyst came up with a phrase that I really like. She said, look, we are the voices for those who cannot speak. And I think that has driven our focus, that everybody has an opinion. Everybody has a side of the fence that they want to be on, particularly the week before elections. But if you're here and you're working with someone who happens to have severe intellectual disabilities and who is nonverbal, let's stay out of the politics and let's stay focused on the person that's in front of us.
Great perspective. Kate, Renuka, how do you think skills have changed over the past decade or so? Is there something that you wish you would have learned coming into this space?
Like, I think what the comment that was made earlier, digital skills, I mean, clearly a shift, right? Because now you're looking at even I'll take the example of COVID, right? Even if you have a very simple test, which is point of care, and you have technologies that are the size of a cell phone, or you have your simple nasal swab point of care that you want to test and say, are you positive or not? Even so, you need to have data. You need to have, to understand the epidemiology and the science. You need to know who got tested, what the result is, were there any other underlying conditions. Unless you have robust data, you're not going to be able to address and bend the curve of this particular virus or any disease state. So having data skills built into the technology, or having the smarts to look at data and interpretation, and therefore digital health and digital technologies, more needed now than ever. The fact that we're all communicating virtually is also a good indication of how you're looking at shifts in terms of even bigger programs beyond COVID, like telemedicine. How do you use that to kind of fill in a gap? It obviously won't solve every problem. So those trends are really unique and different. Trends to say, how do you take large platforms and collapse them into small? So engineering skills that are required without compromising the quality of the technology. I mean, these are big shifts that we've seen over the last couple of decades, so to say, when HIV became this global pandemic. Things were big, and now you're looking at self-testing in HIV, right? Now you're looking at an oral swab that will say whether you're HIV positive or not. Compare that to where we started. So clearly, over the years, you're seeing newer set of skills, newer innovation, newer smarts, the ability to look at segmentation of the market to say what technologies can fit well into what segments. And there's a need for those big, robust, and there's also a need for these small, simple. So the kind of coming together of mapping out individualized care is not far away, but looking at this broad spectrum and saying one size doesn't fit all, even if it's the same. You need to have the same quality for sure, but you can have different models for care. So those are all unique, newer trends, I would say, demanding students to learn, build, adapt newer technologies from different streams of discipline, whether that's digital marketing, digital data reporting and epidemiology, innovative product development, the ability to actually be able to articulate across the world for different unique segments and positionings. Even the way you advertise has changed, right? So I think it really calls for being current and up to date with the evolving digital world is the biggest shift, I would say, from what it was a few years ago.
I can't really answer what it was like 10 years ago because that's when I was first getting into the field. But I think one way that I've learned from COVID is learning that, there's trends in what is the focus of a government and of society. And you have to adjust and see again, one, is what you were doing exactly what you should have been doing? Should you change as well? And if you still want your projects to go through, how do you align them? So 2 examples. One is that now with COVID, there's a lot more funding that's being directed towards that. But so then you have to sort of see, well, is there overlap with some of my initiatives that we can sort of serve more than one purpose? So the one thing that does overlap a lot is air quality. So looking at air quality, people who have asthma or people who are in polluted areas are more likely to have, or there is some evidence. I'm not a doctor. There is some evidence that they respond more poorly to COVID, and it causes more long-term issues. And so looking at air quality, how can we improve the air quality, especially in lower income neighborhoods or in frontline communities? So, what are some things that are missing in those communities that could help with air quality? And one thing is trees, planting trees, which also serve many other purposes, like dealing with rainwater, providing shade, and making an area more beautiful. So, I may have been focused on something else last week, but now we're putting a lot more focus into trees because it meets the needs of both COVID as well as sustainability. Another issue is equity, looking at equity issues, with all the conversations that have been happening around the country, you have to sort of pivot and say, have we been doing this the right way? I mean, we were looking at that issue, but like, were we looking at it enough? Do we need to make this more of a focus of our work and, call more attention to it and have more conversations around that? So I would say, pivoting to the national moment or the moment is very important and a good skill in order to make sure that, your work stays relevant.
So can I add on to the point that Kate said? I think she just jogged another talking point for me when you say this unserved and underserved communities could exist anywhere, right? Right here in the United States, it's not equitable access just because it's America, right? So I think I'd strongly recommend to the students who are dialing in to read this book called Factfulness, which really talks to the point of how you can have a very developed world, but still a segment that's unserved, underserved. And you can have a very developing world country that still has some very rich and then several unserved, underserved, right? So it's, again, adjusting to the needs and looking at models and skills of what is common with these unserved, underserved, and would those strategies work across the globe? Are they unique or distinct? But to not just, I think the classification of just high income, middle income, low income is no longer sufficient. And it's really to look at peeling that onion, if you will, and to say, even within one developed country, what are the unserved and underserved segments? And your comment kind of jogged that in my mind to say that there's a need everywhere for the equity or equitable distribution and equitable access, whether you're in a developed or a developing nation. And I think looking at your markets in that context for students would be interesting to say, what problems are we solving, even if it is a very developed world? Just wanted to add that and refer to this book, which is definitely an interesting read. It's a quick read, but an interesting read.
Thank you. And I put the name into the chat as well for those who didn't pick up on it the first time around. So that's in the chat as well. Just so everyone's aware, we're coming up and about 15 minutes left. And so I do want to ask one question and then open it up to the audience for questions. So please feel free to keep the questions coming into the chat. Obviously, lots of young people on this session as well. And so just wanted to hear what advice you might have for people trying to get into your sector.
Well, I'll kick it off. When I got out of graduate school, it didn't really dawn on me that nonprofits would be a career path. Typically, nonprofits at the entry level are viewed as paying very little and requiring a lot of work, and that may very well be true. But at the executive level, the nonprofits, I'm thinking particularly around the Philadelphia area, if you pull some 990s, I think you'd be surprised to find some executive directors that do very, very well. I think also important is to find a mentor. When you're coming out of graduate school, if you can latch onto a mentor, ask intelligent questions, and then without fail, do what they suggest before you get back to them. Because if you've really attached to a mentor, and I'm thinking of one particular guy who runs a publicly traded IT firm, and they're willing to give you their time, that's their most precious commodity. If they find that they say, you know, Noah, do this in response to one of your questions, and you fail to do it when you come back to them, it's not going to be a long-term relationship. But I do think that that's a critical connection post-graduation, to find somebody that'll help you steer through a lot of the difficult questions that come up.
So for me, I'll say follow your passion. That I think is very important. I found myself, if I look back at my long career, the times when I performed really well are when I follow my passion and play to my strengths, so to say. I also think at different phases in your life, you want to pursue different opportunities, but be bold with your choices. It's okay to fail. It's not the end of the world, because through that failure, you actually learn something new, and you become stronger, and you pursue. So I think sitting back to say, and you know, typically when people say, where do you want to see yourself in the next 5 years, 10 years? It's a really hard question. You want to first get a job. You want to first get settled in something and then build on it. But I do still think following your passion, and remember that you steer your own career. You have the choice to take it as fast and forward as you want to, or not, or fail fast, move into something else that you think you're better at. I see a lot of trend with the new generation where they want a change every 3 years. There's a little bit of, when I say I've been with a company for 23 years, I get this, oh my God, what were you thinking, or how and why? And I'd say I stuck with the company, but in different roles, in different parts of the business, in different continents. It didn't feel like I was doing the same job. And by the way, if you love doing the job so much, it's okay to do the same job, right? So I don't think there's a formula for a well-framed formula. I think it also, you bring in your own uniqueness into this. You know, how much are you enjoying the work? How much do you want to learn from it? It's okay to move fast like the rest of the world if you want to move. But what I'd say is always keep your skills up to date, so that you're marketable in this new world. And if you're stuck in the same role without updating your skills, that could become a challenge. But really taking time to build that resume, to say which is the type of company you want to be in, what do you want to do? And I'd say in your early phase of career, be hungry to learn first, to learn as much as you can from the different disciplines. Many companies offer a rotational program into different functional areas. Take advantage of that, because it's through a bit of trial and error that you actually discover what you love the most and where you want your longer term to sustain. So I'd say whatever comes your way, take it with that greed to learn, to master, and to be open-minded. And you have, a world of opportunities ahead of you. no matter how constrained times are and how difficult it is. Believe me, I have two kids who are in college, and we worry with what's going on. What are their internship opportunities? How will they come out of this? But as we heard, this too shall pass. So I'm sure it'll all come along fine. But I always say it's in your hands. Literally, feel that ownership, learn from the rest, but you drive your career, so to say.
I would add, don't be afraid of unconventional paths to where you need to go. You may not find the job that exactly matches what you want, but it still provides an opportunity, and it's somewhat, tangential to what you are passionate about, then I would go for it. When I finished graduate school and I moved to Chicago, I was having difficulty finding thing, right off the bat in a planning position. I ended up working with an organization called the Urban Sustainability Directors Network, which worked with planners. And I was put in a position where I was more assisting them, which wasn't what I had ideally wanted. And, it felt a little frustrating, but it was actually an amazing opportunity because I learned a lot about sustainability and what a sustainability director is. Through that position, I was able to get my first environmental planning position. And then now I'm part of USDN as sustainability director. So don't be afraid to take those unconventional paths, and don't see it as a setback if you don't get the position that you really wanted right away. You can still get there. It's you have to just deal with the world and what's available at a given moment. But just don't lose sight of what you care about.
Thank you. So we have some great questions in the chat. One of them is, what do you think social innovation will look like? Will it become more digital, more connected after COVID in particular?
What do you think social innovation will look like, you say? Yeah, I mean, I think one can imagine expanding some of these models to various other industry sectors too. I mean, I can imagine sitting at the comfort of your home, or sitting wherever you are, if home's not comfortable, but to be able to get tested, to be able to have your data instantly, to be able to work remote. I think work life post-COVID might change a lot. So I think you'll have innovation in the way you reach audiences, in the way you message your products, advertise for your products, and the way you actually look at sales and marketing. I really think all of that will change post-COVID. I mean, you will still have offices clearly, but I don't know if the new normal will ever be the same as it was. So people will adapt and change to new skills and new technologies. I think we'll see a flurry of. You can imagine that they would come in. It'll be interesting to understand and see. During the kind of COVID crisis, we've seen certain technologies and industries really doing very well, the hospitality not doing that well, and the new reality might be somewhere in between. So the sectors that you pick and choose, you'll see a lot of innovation in some of these digital sectors for sure. Wellness sectors as well. When you look at how people have become more mindful, more conscious of work-life balance, and so I think it'll be interesting to see all kinds of innovations still in the space. But I do think COVID is going to bring a pause to how we look at equity and how we want to solve problems everywhere, because otherwise it can come back to becoming, who would have ever imagined a virus emerging in one part of the world to kind of reach the entire, with literally no countries being spared of planning and taking the necessary precaution, right? So I think people will kind of look for equitable access a lot more, is my view at least, or I hope at least that's the case.
I mean, sorry.
I was just going to say, in public engagement, I think that two things have become clear. One is that people do really crave in-person interactions, but having everything digitally accessible is really helpful in making it seem more approachable to engage with a lot of public institutions like city council meetings, and providing input at other meetings where people wouldn't have been able to take the time to go to those public meetings. So I think it'll, not completely go digitally, because you do miss out on a lot of things when you can't interact one-on-one, but I do hope that it continues to allow more people to engage that wouldn't have otherwise.
Yeah, and I was going to say that we've seen a tremendous increase of use of telepsychiatry on both the substance abuse treatment, court-mandated involuntary, as well as access to mental health counseling services. I think the use of technology to reduce the barrier of getting in your car and driving a half an hour to a 1 hour visit and then going home has really assisted with that. On the other side, the educator in my soul looks at what's going on with remote instruction for kids with special education. And for certain kids, that's fine. For kids with severe, let's say, self-injury, it's absolutely not going to be appropriate. And so I don't even know that we have the body of professionals available because it was such a massive run of retirements after the No Child Left Behind. But we have to take a look at education. I think there's positives and there's negatives, right? There are certain children who will not be able to be served remotely. And what do we do for them and how do we do it has to be taken in. Right now, that's not even a part of the conversation.
All great points. We have a great question here, and I think it's really the perfect question to really wrap this up. And again, if there are other questions related to education and the future of business and other sectors, please feel free to jump in. But this question is really around the role of education and how should education change to enable people to become more impactful in each sector.
I think that having people really engage with real life problems is excellent. And it's a way to help students be prepared for the real world if they're going into planning or government. It can be very easy to think of things as like these solutions that you can solve sort of inside of a bubble, and leaving grad school, it's not like that at all. There's politics involved, you can't escape it. And I don't mean like national politics, I just mean like the day-to-day politics, like even personal politics. There's having to deal with really confrontational people and having to navigate that. There's so many things that really help, if you have the real life experience. So I hope the people in the planning fields or in government take the opportunity while they're in school to do some sort of like project where they're actually working with an organization, like a internship program, or something that is like a real project that you can sink your teeth into and really see how you have to sort of pivot along the way. I think that that's really helpful, and the students that I feel are most prepared to work within the field are the ones that have taken lots of opportunities to try things out and aren't just being idealistic or having a very set way of thinking about how they can solve problems.
So I can add on and say, as we're talking so much about digital health and digital innovation, one thing that I worry about for students is everything is so digital. The way you interact with kids these days is a text message, and it's even in the text message, everything is an acronym here or there. And to prepare students to say, well, that's great, but also to have these the ability to actually mingle with people and take teams along, which is not the same as a quick, digital communication. There are people involved. There is emotion involved. There is how do you build strong teams to solve problems, not to miss out on that aspect, which has become increasingly difficult during this particular remote learning time frame, but to have those people skills still to be able to present in depth and in detail, which is very important. And certain disciplines demand that a lot more. So it's not just about a quick digital communication, but it's a broader, to have the heart and soul, even if your message is small, to be able to be taking these opportunities for learning and say, how is your job? Your jobs are going to look very different from the jobs that your parents had, just because of the changing times. And so how would you keep that going forward, building on those skill sets, but just looking at the wonderful opportunities. I think I really like what Kate said. Don't be afraid of unconventional paths, right? Take on anything that can, and look at that as a learning platform and a learning opportunity, and build from there. Whether you're working in a government sector, in a for-profit, in an NGO, all of them are solving complex problems. So look at that as, what's the problem you want to solve, and embrace it wholeheartedly, and you'll shine, because you know, every time you solve a problem, you're actually building a skill and you're feeling that sense of an accomplishment. So to be open, but not to be too narrow with just digital, and not to be missing out with digital at the same time. So to be able to have that all-round development of being a curious learner, being wanting to try new things, taking on the path, conventional or unconventional, and driving your own career at your of where you want to go, steering it that path, and just being, you know, being connected. That's the other thing, because today you have resources where you can learn from each other, and reach out to schools to seek that help on where and what you want to do. So I just think it's really as an exciting time to think that a conference like this could be reaching out, you know, a large audience in one go, where you're able to again interact and connect seamlessly, is a testimony to, you know, what possibilities can exist for you if you're willing to take advantage of them, so to say. So those are my observations or comments.
If I was to weigh in and make a final comment on this subject, it would be that education that's applied is much more useful than education that's static and set apart discreetly. I credit going back to Wharton's entrepreneurial school. The project, which was your whole grade, was to do a new venture initiation. And as part of that, I remember we were looking at doing a shopping center in the Princeton area, and we had to go out and talk to planning people, zoning people, people that I never would have thought about, that could have stopped us from doing our deal, so to speak. And I think that applied type of education is available now because technology makes it available. It's also essential because what you learn in a book is not going to be what you're going to find out there.
Absolutely. So what amazing insights. Thank you all for your time. I just want to recap in terms of, you know, this is a really changing landscape. Obviously, COVID has forced us all to pivot dramatically across all sectors. There are ways that each of the sectors can collaborate with one another in order to become more effective, and you know, through private-public partnerships, interactions with government directly, and shared value. And so I think there's a lot there to consider. And that means that education will need to adapt accordingly. And so I think whether it's educators who are on the line today thinking about ways that they can change their curriculum and experiential learning opportunities, whether it's students trying to get into these various sectors, you know, we just are really grateful for your time and your energy and insights today. So thank you all for joining, and thank you especially to our panelists.
Thank you.
Thank you all. Wonderful panel.